Based on the site in the abdomen, we can conclude to a diagnosis. If the pain is in epigastric region, it may be due to peptic ulcer, GERD, MI, aortic aneurysm, and pancreatic vein, gallbladder, or common bile duct obstruction. If it is in right upper quadrant region, acute cholecystitis, biliary colic, and hepatic abscess or hepatitis, and hepatomegaly due to CHF, perforated duodenal ulcer, MI, and herpes zoster, right lower lobe pneumonia. Left upper quadrant pain causes are pancreatitis, gastric ulcer, gastritis, splenic enlargement, rupture or infarction, myocardial ischemia, and left lower lobe pneumonia. Right lower quadrant pain, appendicitis, enteritis regional, and small bowel obstruction, leaking aneurysm, ruptured ectopic pregnancy, pelvic inflammatory disease, and twisted ovarian cyst, irritable caliculi, and hernia. Left lower quadrant pain, diverticulitis, leaking aneurysm, ruptured ectopic PAD, and twisted ovarian cyst, irritable caliculi, and hernia, and regional enteritis. Diffuse pain is seen in generalized peritonitis, acute pancreatitis, sickle cell crisis, mesenteric thrombosis, gastroenteritis, and intestinal obstruction, ruptured aortic aneurysm, and metabolic disturbances, and psychogenic illness and intestinal obstruction. Periumbilical pain is diseases of transverse colon, gastroenteritis, small bowel pain, and appendicitis, and early bowel obstruction. Pneumonia and inferior myocardial infarction and pulmonary infarction will cause referred pain to periumbilical area. Next comes the renal colic. Renal colic, colicky pain comes suddenly, increases in severity, and stops suddenly only to come back again. So renal colic is stored in pelvis or kidney. Pain in right or left renal angle may be associated with vomiting. Treatment we give injection Goveran 2 ml IM stat and a metoclopramide 2 ml IM stat if vomiting is there. Tablet cyclopam, 1 tablet TDS, and IV fluids if there is severe vomiting. We have to advise urine examination to see RBCs and pus cells, and ultrasound abdomen for presence of kidney stone. If stone is found, refer to urologist. So based on the stone location, the symptom will vary. If it is in the kidney, vague flank pain or hematuria. If it is in proximal ureter, renal colic, flank pain, and upper abdominal pain will be there. Middle section and distal section. Distal section there is dysuria and increased frequency of urination and anterior abdominal pain and flank pain. Whereas middle section, renal colic and anterior abdominal pain and flank pain. And the renal calculi can cause blockage of the ureter at 3 millimeters. Ureteric colic. Severe spasmodic pain on one side of the abdomen coming suddenly and traveling from loin to groin, that is back to the front. And the pain is so severe that to patient refuses to lie down. There is no tenderness and the dysuria may be present. Injection 4-twin pentazocine 1 ml IM star if available or diclofenac IM star we have to give and injection phenol and promethazine IM star. It is sedative and also treat associated vomiting and patient make the patient lie down and rest after injections. Cancellation 0.4 mg OD to accelerate the stone passage and send for ultrasound abdomen and X-ray on empty stomach after bowel preparation. If the stone is less than 6 mm, try hydrotherapy. IV dextrose 3 pins pass to be completed in 1.5 hours and give IV Lasix and IV cyclopam in the third pin for 3 days. If the stone is bigger than the 6 mm, we have to refer to urologist in case of ureteric colic. Here, X-ray is showing radio-opaque stone in the ureter. Next is appendicitis. Abdominal pain, periumbilical at first, then right iliac fossa. Within few hours, it becomes persistent. Onset is usually sudden and may arise in the right iliac fossa and remains there. Heterocecal appendix may cause flank or back pain, and pelvic appendix may cause suprapubic pain. Anorexia nearly always accompanies appendicitis, and vomiting occurs in about 75% of patients. Most vomit once or twice. Most patients give the history of constipation before the onset of pain or diarrhea in some, particularly in children. Fever low grade around 100 degrees Fahrenheit or occasional hematuria. Murphy's triad is pain, vomiting, and fever. Stage of shock. Pale, anxious, sweating, and elevated pulse rate with low blood pressure. Temperature is subnormal and respiration is rapid and shallow, and tenderness in right iliac fossa. Stage of peritoneal reaction. Severe local tenderness in the right iliac fossa. Rebound tenderness and board-like rigidity and marked rectal tenderness in the right iliac fossa. Stage of flank peritonitis. Abdominal distension, absent bowel sounds, and fecal vomitus and dehydration. Local signs, tenderness of the localized and persistent nature is the most important abdominal finding, situated in the right iliac fossa, classically at the McBurney's point, junction of middle and outer third of a line from umbilicus to anterior superior iliac spine. Rigidity over right iliac fossa and rebound tenderness illustrated by percussion, and tenderness on the right side during rectal examination may be seen with pelvic appendicitis. Rousing sign, palpating in the left lower quadrant causes pain in the right lower quadrant. Obturator sign, internal rotation of hip causes pain, suggesting the possibility of inflamed appendix located in the pelvis. Dunphy's sign, increased pain in the right lower quadrant with coughing. Iliosova's sign, extending the right hip causes pain along the posterolateral back and hip, suggesting retrocecal appendicitis. McBurney's sign, to elicit sign, patient should be in supine position with their knees slightly flexed and his abdominal muscles relaxed. Palpate deeply and slowly in the right lower quadrant over McBurney's point, located about 2 inches from the right anterior superior spine, on line between spine and umbilicus, one third outer side. Point pain and tenderness is a positive sign and indicates appendicitis. Clinical features are cold breath, pointing sign, and cough tenderness, and tachycardia and coated tongue. Alvarado score above 8 to 9 sure, below 5 negative, 5 to 8 is investigated. Anorexia, nausea, vomiting, and fever, leukocytosis, shift to left. The rebound tenderness and right iliac fossa tenderness, right iliac fossa pain. Differential diagnosis in case of children is gastroenteritis and mesenteric adenitis and Meckel's diverticulum and intussusception. Adults, regional enteritis, colic, perforated peptic ulcer, torsion testis, and pancreatitis. Female, pelvic inflammatory disease, pyelonephritis, ectopic pregnancy, ovarian cyst, endometriosis, and fibroid. Old cases, diverticulitis, intestinal obstruction, and carcinoma colon. Weselstein's sign is increased pain in the right iliac region as the person being examined lies on his or her left side. Ultrasound will show eperistaltic non-compressible dilated appendix more than 6 mm outer diameter and distinct appendiceal wall layers and periappendiceal fluid collection or enlargement. Diagnosis is based on the results of the complete physical examination, laboratory and X-ray findings. CBC demonstrate elevated WBC, count may exceed 10,000 cells and neutrophil count may exceed 75. Surgery is indicated if the appendicitis is diagnosed. Analysis can be administered after the diagnosis is made. Morphine, antibiotics like cefotaxime, levofloxacin, and metronidazole can be given. Open or laparoscopic appendicectomy is the surgery. Next is spasmodic dysmenorrhea. There is severe lower abdominal pain, especially in unmarried girls on the first or second day of menses. Primary dysmenorrhea is natural uterine contraction cause high prostaglandin concentration. Due to high prostaglandins, there is uterine contraction aimed at lining of the shedding in its lining. Secondary dysmenorrhea is due to endometriosis, uterine fibroid, and pelvic inflammatory disease. Treatment is tablet mefenamic acid 500 mg TDS and injection over at 2 ml IM stat and hot fomentation of the lower abdomen and bed rest, and if it is not resolving, refer to gynecologist for further advice.
Procrastination is caused by the fear of success. You know if you did it, you'd win and you'd be better. So I didn't do it so I could be my comfortable self. Next thing I knew, the opportunity passed. It felt so good just to be me again.